So today I'm talking with Suzanne Keyes, and Suzanne owns Keyes Compounding and 180 Wellness, and she is about to get her functional medicine certification this spring, which is really exciting and sort of a different avenue for pharmacists to go in. So the first thing, Suzanne, I'd like to hear about is, you started in a more traditional way with a compounding pharmacy. And what led you to want to go into functional medicine, and how are you incorporating that into your practice, and what do you see as a bigger vision down the road?
Well, like you said, first of all, Anna, thank you so much for having me. I'm so excited to be a part of this.
Me too.
Yes, this is so exciting. Like you said, I started my career in pharmacy in a very traditional retail setting. And, over my 20-year career, I had worked in hospital, long-term care. I was a relief pharmacist for several years. I even worked for a PBM as a PA in the PA department, which was kind of weird and glad that was short term. And then 6 years ago, I ventured into entrepreneurship and decided to open a compounding pharmacy. And, the first 2 years, I followed more of a conventional route, that in the sense that I filled prescriptions based off the doctor's orders, but I also offered hormone testing, so saliva hormone testing. And patients would purchase the kits from me, and then I would suggest the corresponding therapy, hormone therapy, based on the results. It wasn't too long after I started doing that I realized that this test and treat method was not producing resolution of symptoms, and patients weren't very successful. Mm-hmm. So I knew something was missing. But I couldn't figure it out for a while, because I was like, well, that's what we do in the medical society, is we are taught to test, and then whatever you're lacking, we just replace it, or we have a pill for it. So kind of lending to the term of we're a pill for an ill society, I guess. Anyway, I recognized that I was losing patients fairly quickly after about 3 to 4 months of their therapy that was supposed to be so wonderful. But more importantly, I was actually losing my reputation for helping people. And that really caused me to stop and focus on what was going on. All those patients that were dropping off, I guess they had kind of realized that my magic cream really wasn't all that magic to begin with. And then they were telling other people. So that hurt me for a while. So the need for change was very evident, and very, very quickly. It dawned on me that every single patient that came into me basically had the same set of symptoms. They were just varying in degree. And before I knew it, I started wondering, what in the world are we all, myself included, doing or breathing or ingesting or being exposed to, that's creating this milieu of chronic conditions and symptoms in every person. So that was really that moment where I first started questioning it, and that led me down the path to basically a self-study program on my own after hours. So I'd run the pharmacy during the day, and I would really dive into the immunology components of how the body works. And so I spent a long time, about a year, gathering all this information, trying to figure out what was creating this. And then once I gathered the information, then the hard part came. And that's when I had to link all of it together and make it make sense, and then make it make sense to a layperson, to the patient. I've always felt like if we didn't understand where everything started, then it's very difficult to go back to the start and undo what's been done. So it was probably about 18 months into my journey when I found an actual organization. Of course, it was after I had reinvented the wheel.
Right.
So I found IFM and literally heard angels sing, and saw that they offered a certification path, and the rest is history at that point.
And I know a lot of pharmacists believe that unless an insurance company pays for it, that they can't offer a service. And you and I kind of operate in a similar vein that way. We charge patients cash, and not an insignificant amount of cash, for consultations to help improve their health. So, what would you say to a pharmacist who was afraid to like step out on the edge and start actually charging for their services? Because you know this, and I know this, we're notorious for giving our brains away for free, and we need to stop doing that.
Exactly. And, on that note, when I have a student in here, and I historically, like you said, we were taught to give away our education for free. So it's very out of your comfort zone. And it's funny that you would bring this up, because I was that pharmacist. My operations manager and functionally trained pharmacy tech used to go with me to these conferences, and she would learn right alongside with me. And so she would call me out in these pharmacy conferences and say, maybe nobody was doing functional medicine, but they were at least offering a little bit more skilled consultations. And so she would call me out and go, my pharmacist is the only one in the United States who doesn't charge for anything. So I finally, and this is what really threw me into charging and setting it up more like a doctor's visit or a scheduled appointment, is that my staff came to me at one point and said, we love what you're doing, but when people come in and just suck your brain dry over the counter at all times, it's bottlenecking the pharmacy.
Yep.
And that's where it hit me at my core. And that's when I took that very first leap, and I thought, you know what, this is how it progressed. I thought, I'll charge $65 for an hour consult.
Woohoo!
Well, my staff knew that there was no hour consult. Go into that. But also because you can't get some of these fundamental points across to patients in an hour.
Right.
Because you're going to go over so much. So it ended up more like a $65 for an hour and a half to 2 hours. So I did that for a while, and I got the same result where I would see these patients. They really weren't vested. $65 isn't a lot of. So they would come and they would sit and listen to me so that they could get their prescription. And then they would never follow anything I had said. So as I learned more, and as I felt more confident with where I wanted my practice to go, I began changing my fee schedule.
So, I mean, it's totally possible to make a decent living.
Absolutely.
Doing cash-based consultations. And I think that's something that people need to realize, if they can just figure out, who their niche people are and where to find them. Which is the beauty of an online business, because you have the whole world to find them from. So.
Exactly.
So what's been your biggest lesson as an entrepreneur?
Well, my biggest lesson as a functional medicine practice in that area is that I learned, and this really I can take into anything, is don't go into battle unprepared. So with that said, as it pertains to my consultations, because it does kind of put a pharmacist in a very precarious position, because you want to make sure nobody misunderstands you as a diagnosis that you're diagnosing or you're treating without a medical degree. So I make sure that I'm just the communicator. So my firing power when I walk into battle are my medical studies and the clinically based medical evidence medicine and protocols. And I would tell patients and the physicians that question me, and I would say, this is not my interpretation. Here it is in black and white. And so that was my biggest lesson, is not to go without having those things at your fingertips. And it's not necessarily that you have to know all of it. You just need to have it available.
Right. So what are you excited about as far as the Medipreneurs Conference?
Oh, first of all, because it's one of a kind. I'm so excited. I can't wait to be a part of it and to learn from all of the wonderful speakers that you've got lined up. I think, like what we talked about before, is just to have a place where pharmacists that are looking for something different, in the light of DIR fees and health cutbacks and PBMs, clawbacks and everything, I think pharmacists are we're searching for something that's going to help diversify. and increase our income and continue to help patients. And anything that falls into a way or a method that can help expedite that, I think is fantastic. And for this to all be a conglomerate together, it's exciting.
So what would you say to a pharmacist who was thinking about attending but was on the fence and couldn't decide?
It's a no-brainer. What we're doing isn't working across the board. Eventually, if you look at the way things are moving, we're going to come down to 4 places for pharmacists to work, and it's going to be the big box group.
Yeah, exactly.
So to hear from these experts who have ventured out and created this path is absolutely priceless. There couldn't be any reason why anybody should be on the fence. And
it's got 8.75 hours of CE. So for people like me who wait until the very last minute, it's a win.
Yeah, absolutely. That's a lot.
Well, thank you so much for being here with me today. I've really enjoyed talking to you, and I can't wait to meet you in Asheville and get a chance to hang out with you and learn more about what you're doing and talk big ideas and how to go straight to the edge.
I agree.
All right. Thank you.
Bye-bye.
Bye.